Well, hello, everybody. My name is Dr. Arinola Dada. I'm a rheumatologist in the greater Seattle area. Welcome to Rheum with a Viewpoint. So we are going to talk about that notorious ANA test. Patient comes into your office and you're like, hey, let's just run a wellness check and let's order the ANA test. Or the patient comes in and says, hey, doc, order everything. Okay, we're going to talk about 5 reasons why you do not want to order an ANA test without really kind of thinking through these 5 things. So one, and I'm sure you know that the ANA test positivity does not exclude other conditions. So there's a high incidence of having ANA tests in people. So for instance, elderly women could have a positive ANA test. Okay. And it's very common in them. 2, there's a high false positive rate for an ANA test. For instance, cancers can cause an ANA test. Viral infections can cause an ANA test to be positive. Medications can cause a false positive ANA test. So a number of things, including even the thyroid, can cause a false positive ANA test. Number 3, context matters. So if you have a patient that has particular symptoms, joint swelling, strong family history of autoimmune disease, malar rash that you can't understand, hair loss, those kind of things, then yes, when you order that ANA test, is actually going to be a valuable test. Because if the patient does not have those symptoms, are you just running down this rabbit hole that causes worry for you and your patient? 4, there are actually subtypes. So when you order an ANA test, you actually have to think about, well, the ANA test on its own is not helpful until you really order the subtypes. So we have, the double-stranded DNA, the SSA, SSB antibodies are just examples of the subtypes of ANA tests that really helps you understand what you ordered. And then finally, the elephant in the room. What is the pre-test probability of your diagnostic test? So pre-test probabilities, all the symptoms, the hair loss, the malar rash, the sores in the mouth, the joint swelling, the blood in the urine, the fluid around the heart, the pericarditis, the PVC, those kind of symptoms, right? When you have those symptoms and you order an ANA test, then you have put in directions into your GPS. So now you know if the test is positive, these are the things you're going to do with the test going forward. So I hope that these 5 things have told you, hey, before you order that ANA test, think through this. Let's make sure that we're not causing unnecessary worry for ourselves, for our patients, and also minimizing unnecessary testing. So thank you, everybody, for listening. Again, my name is Dr. Arinola Dada, and thank you for listening to Rheum with a Viewpoint. Bye, everybody.